always think about different things. If you're seeing your doctor, ask them to explain the approach. And oftentimes doctors may recommend a treatment. Ask them to explain the underlying condition. They may say you have heart failure. What does that mean? Is it a weak heart or a stiff heart? What causes heart failure? Why do I have heart failure? Ask them to give you some mechanisms to why.
So this patient, her name's SA. She's 63. She has hypertension, high cholesterol, and recently had a pacemaker placed for what we call a complete heart block. So meaning that the electrical signal from the top of the heart wasn't communicating with the bottom of the heart. So she was feeling abnormal palpitation in the chest, lots of dizziness, and a really low heart rate. So they put the pacemaker in, and she wanted to figure out what was the root cause of all of this. What can she do now? Even though she has a device that can pace her heart, she still wanted to improve the electrical activity of her heart. And preceding the whole event of the pacemaker, she had had a viral respiratory infection. She was diagnosed with bronchitis, given an antibiotic empirically, okay, even though the chest x-ray came back before the antibiotic didn't show signs, any major abnormalities actually. So that was about 3 weeks before the hospital visit, and during that time after she finished the antibiotic, she had developed all those symptoms. So when we were talking with the patient, we know what can cause or disrupt the electrical system of the heart. We are thinking, so they ruled out thyroid issues. We ruled out like autoimmune, heart MRI. We ruled out inflammatory or infiltrative diseases like sarcoidosis. She didn't have any major blockages to cause it. And, I was talking with her. We know sometimes severe viral infections can damage the heart. But we also talked about how antibiotics can disrupt our gut health, and the vagus nerve innervates your gut and also regulates your heart rate. And so we were concerned that her gut health could have been a key factor here. And we recommended the probiotics, some digestive enzymes, and some minerals, and a grapefruit seed extract to kind of rebalance the good bacteria and the bad bacteria.
Maybe kill off any pathogens that may have been involved, like, Candida, or whatever, they could have overgrowth as a result of the bacteria.
That is right, yeah. And so it'll be interesting to see the amount of pacing on the device, maybe goes down, because on the last interrogation, her device is still having to pace her a decent amount of time. So that's one thing we're going to be looking for, is with healthy eating and this kind of gut health regimen, that percentage of ventricular pacing goes down.
And what we probably should do is see her here and make adjustments in her pacemaker settings and observe her and see if she has an underlying rhythm on her own and see how that changes.
Yeah.
That's something we can do as well.
Because her other electrophysiologist, because this patient lives out of state, they did lower the rate limit to 50, and that reduced the atrial pacing. But yes, I told her maybe we can get her to come back, stay with us, just to have, a lot of other things we can offer here anyway, too. But I thought that was an interesting case.
Yeah, we have had other patients who've had dizziness and slow heart rate, that with gut cleansing and probiotics, the heart rate improves and the dizziness subsides. So we've seen clinical examples that give us a clue of this, and we have other patients whom we're evaluating for a certain possibility. So the teaching point here is that your microbiome, the gut bacteria, has a lot of impact on the heart. They can have an impact on rapid heart rates and arrhythmias like atrial fibrillation, ventricular arrhythmias. They can also potentially have a slow heart rhythm or bradyarrhythmia. So, we look at these things as part of the total picture of what's happening with the patient. So it'll be interesting to see what happened with her, and we look forward to getting you follow-up. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.